Good morning, and welcome to this public briefing of the Standing Committee on Social Development. My name is Shauna Morgan. I'm the MLA for Yellowknife North, and I'm the acting chair today of the Standing Committee on Social Development. I'll now ask members in the room first to introduce themselves for the record, followed by those online. Start.
Good morning, Karen Testard, member for Range Lake.
Good morning, MLA Danny McNeely for the Santu region.
Good morning, Julian Morse, MLA for Frame Lake in Yellowknife. Thanks.
And we have some members online. Should we start with Mr. Nersu?
Good morning, MLA George Nersu, MLA for the Mackenzie Delta.
I'll just go. Hi, good morning. My name is Robert Hawkins. I'm the MLA for Yellowknife Center. I'm not a member of the committee, but I do like to pop in on the social development issues as well as the seniors matters of great interest to me. Anyway, always happy to be here. Thank you.
Thank you, members. So today we're going to receive a briefing on healthcare accountability and sustainability. From a joint presentation between the Yellowknife Senior Society and the NWT Senior Society. So please note, this meeting is being live streamed to the Assembly's social media channels, and I would like to remind all members and witnesses to direct all questions and comments to myself as chair and wait to be recognized before speaking to help us have a smooth meeting. So I'll now pass it over to the YK Senior Society and NWT Senior Society, and maybe we'll begin by just introducing yourselves, and then feel free to proceed with your presentation.
Well, the Yellowknife Senior Society and the NWT Senior Society would like to thank you for this opportunity to provide you some insight into our issues. So I will introduce, behind me I have Kim Doyle, who's the Executive Director of the Yellowknife Senior Society, and Karen Willy, who's the Executive Director of the NWT Senior Society. Pat Bernstad is the President of the NWT Senior Society. Wendy Bizero, I see up there, is the past president of the Yellowknife Senior Society, and I'm Jill Christensen, and I'm on the board of the Yellowknife Senior Society. We come en masse. So we'd like to thank you for this opportunity. I just have a question, and it's regarding how we get our presentation up. I don't, I guess.
There it is.
Okay. And then, oh boy, that's small.
It's going to be enlarged.
Oh, there.
For seniors, right?
There. Seniors need bigger font. This presentation will explore the lived experience of seniors, and it's intended to provide a point of view regarding real life issues that NWT seniors face when accessing the healthcare system. We're representing seniors. We've talked to many seniors. We've received feedback from seniors across the north as well as Yellowknife about their service experiences. And we believe that these issues relate to accountability and sustainability of the NWT health system and ultimately seniors' health and well-being. Pat will take it. Pat and I are presenting together.
Okay, I'm doing medical travel, and I know from I haven't traveled very much medical travel, even though I'm 80 years old, so I'm lucky. But I find when I have been on a plane, I didn't stick to the notes very well, so you're just going to have to put up with me. All the problems that occur on medical travel are definitely affect our seniors, because a lot of them have many issues, not just one issue, but many physical issues. So getting on and off the plane is number one problem to begin with, then sitting and waiting in the airport, sitting and waiting at the hospital is extremely difficult. And just waiting for hours, it causes a lot of stress. Or finding your spot at Kitscory is not available where to stay when all the rooms are full. Or arriving at the airport to find you're on standby because you didn't know you were on standby. Then now all of a sudden you can't make it home, which causes a slight problem for some of our people. I'm thinking Hay River. Our people, they can come over and get home the same day. Well, if they're on standby, they can't do that. So all of a sudden, they've left their pets in the house, and there's a major stress attack, like what's going to happen to the dog as he rips up all the paper in the bathroom and all the paper in the house and demolishes the place. So before they even get home, they're totally stressed out. Okay, appointments with doctors can be done on phone, so we're wondering why can't we do that? If appointments can be done on phone, why, if it's just a basic issue, why can't it be done at all for any issue that you don't need to see a doctor to do? Okay. And escorts for medical travel, I always I have a friend that goes with her husband and he's her escort, but he needs an escort. And so I'm going, how does that happen? You know, or some people go, we have one person in the past that went for a eye appointment, was blind and didn't have an escort, which is really scary. So, so sustainability, one of the things I just went on it, and I don't want to bring it personal, but I had a medical trip to Edmonton in June, and I was absolutely amazed at how can we sustain medical travel. On that, my ticket was $2,500. The person from Simpson sitting next to me was $3,000. And there were people from farther north, which means their ticket costs had to have been more. When we arrived in Edmonton, there were 3 buses to pick us up with approximately 10 people per bus. And even if we looked at the average of $3,000 for the tickets, you're looking at 30 people times $3,000, $90,000 for that trip. Like, I just was like, how can this happen? And then we're not even taking into account the cost of the hotel or the meals or the buses to get people back and forth from the city. So we can't really say that's sustainable. Like, I was totally amazed. I talked to our member of parliament in Hay River and said, like, how are you paying for all this? And he said, well, everybody gets medical travel. And I'm going, but that isn't really what I asked. Anyhow, that was medical travel for me, and I mean, it's astounding that it's sustainable. Anyhow, that's all I have to say on medical travel. You haven't got my notes. Go ahead.
I'm trying. It's not going.
You have to point it at this round ball. And then it's.
No.
Oh, there you go.
Okay. All right, our next issue is around the whole issue of seeing a health professional. There are many issues around that, and in addition, issues around support for Alzheimer's and dementia patients and their families. So there are several issues that seniors have brought up. One of them has to do with the health information that they receive, and keep in mind this is across the north, not necessarily in a language or terminology that they understand. And I know this is a wide issue across many other areas as well. Seniors generally feel unheard, that the professional is not hearing us as we describe our problems. We feel there is a need for more support for Alzheimer's and dementia patients and their families, for example, respite care and day programming, which is not consistent, and this is true not only in Yellowknife, but I understand in other communities like Hay River. And we also are concerned about home care supports that need to be increased to support seniors aging in place, because that is the ultimate goal. So in addition to that, many communities lack health professionals or they don't have consistency with health professionals. And this is a widespread problem in the communities. In Yellowknife right now, making an appointment is frustrating for those who want to get a doctor's appointment. The experiences have showed that phones are not answered, calls are not returned to speak to a doctor. And then we have the same day system now for appointments, which has generated several problems for seniors in that you have to stand in line at 7:30 in the morning to see if you can get an appointment for that day. And so for a lot of seniors, not everybody's able-bodied. They have disability or mobility issues and have to get down to stand at 7:30 in the morning to make an appointment for that day. If they're lucky enough, they may get an appointment for the day, but for some seniors, it has meant taking a cab down and back to their home and a cab down and back for their appointment, which gets very expensive. So that system it's one I'm wondering if they could look at the Department of Transportation system. If you've ever tried to make an appointment, you have to stand till 8 o'clock when the clinic opens. Another issue or concern that we have is around locums, and we feel that this is a Band-Aid solution, and I know it's one that has been raised by other people. But a big issue around it is, do locums receive any cultural awareness training? And specifically, do they also receive information on the community that they're going to be working in? So an example I can give you is a locum may not be aware, being in a small community, of what resources are available to people and what may be available in the stores. So you could have a locum tell a senior, you need to eat more fruits and vegetables, without knowing that in that community, you're lucky if you have fresh fruits and vegetables, and as a senior, be able to afford them. And that is a problem that's across the whole system. And we're wondering why we have so many locums and not a stronger northern base of health professionals, because what you'll find is that health professionals who've made the North their home are very aware of what's available in their community, and they also support the community in so many other ways, where a locum brings a certain richness, but it can be frustrating having to tell your story over and over again, and I've heard that personally from working with communities, is that having to repeat yourself over and over again when you have a locum. So that's a concern. We're wondering why it's so difficult to get a family doctor. That seems to be a big issue right now. And how does the system set priorities for services? For example, seniors often have to get bone density testing. It seems to come with the age grouping. And we used to have the ability to do that here. We had a machine, we could get bone density done here. Now you have to travel out. It does not seem to be the most efficient use of services, or I understand we still have the equipment, but to be doing that, and bone densities are very important for seniors' health. Another issue that we have as seniors is the length of appointment is restricted to 15 minutes. And so often seniors have more than one issue, complicated issues, and a 15-minute appointment is a rush. If the locum or the doctor goes over that 15 minutes, then of course you've caused a problem with other people being held up for their appointments. So in addition to that, because it's so rushed, seniors often feel not heard or listened to because there's not much of an opportunity to discuss the whole situation. Some doctors will say that it's a one-issue appointment, which is, like I said, with seniors, it's never one issue. They're always correlated somehow. As a result, you have seniors taking their problems to emergency when they can't get an appointment, and we feel that this is not the most appropriate use of those services in an emergency department. Pat?
Okay. Are you flipping to the next one?
Yep, got it.
System morale. The first item there, we're losing some doctors. When I looked at that, I went, just a minute, we're not losing doctors, we don't have any. And all we have is locums and nurse practitioners, and thank God for them. I walk through our hospital, and I live in Hay River. I get the feeling that we have unhappy workers. Nobody smiles. They do their job. But there's sort of there's a missing link here someplace. Like, they're not happy, our residents aren't happy, and of course, we're seniors, and if you know seniors, we tend to grump a lot, which means we're probably grumping at the hospital, which makes them unhappy too. So it's sort of a system that just keeps rolling around. So nobody seems to be too happy with what's going on. Anyhow, and I'm repeating what you said, the locums, we see our locums and we have 15 minutes, like just saying, good morning, how are you? Maybe we don't say that anymore. And so you haven't got much time left, and you've got 10 issues. Like, I don't have 10 issues, but I know a lot of our seniors do. So there's a bit of a problem there. And then they say, we can't talk to you any longer, out you go. Okay, so out we go. Anyhow, there's definitely, it's just not looking good. And locums don't know I mean, they're good. We have a lot of good locums that come in, thank goodness, but it doesn't work. And I think back, like 10 years ago, we had a gal that organized all the hiring of the locums that came into the hospital. She would organize all the things they could do in the community. And those locums used to come back. They got so we knew them. Whereas she quit and everything fell apart. They used to go out on the lake, they used to check out the falls, do all the things, have parties on Friday night. All of a sudden you've got a team working together, and they knew each other and we all got to know them. And so they would come back, now they don't. So maybe we need to work at telling our locums what's great about our community and doing it. Anyhow. And the other last one that here, recommending the committee interview doctors, I think that's a great idea. Like interviewing doctors and nurses, why are you leaving? And a lot of our staff will say, why should we stay? The locums are paid better than we are, and we stay here and we're here 24 hours a day. Like, why are we staying? So they leave. So all of a sudden the system is not getting better, it's getting worse. So that's all I have to say on that one.
Well, I'd just like to add to that, because when you talk about system morale, my family doctor, who's now left, was in tears at one of my appointments because she said it's so frustrating. Most of her patient load is seniors. She's allotted 15 minutes for an appointment and realizes that it needs to be much longer. So from her point of view, as a physician, it was simply not enough time to be able to do a thorough job with seniors, and she has now left. So I feel like we're losing some good staff because of morale, generally throughout the whole system. When it comes to staffing, we just have some questions here for you to consider in a sustainable and accountable healthcare system. We're wondering, how does the GNWT qualify or certify doctors, nurse practitioners, nurses, and other service providers? Do they have a policy recertification of foreign trained health professionals to encourage them to come here? And why does it take so long for these things to be actioned? Another question we have is, will the NWT align with other provinces and territories on the credentials to make it easier for health professionals to get accredited sooner and then be able to work here where we desperately need them. And we realize it's a problem all across Canada, but we feel that's just not a good enough answer for the NWT. It can be a lot better. Your turn.
Oh, sorry, you haven't switched.
Oh, well, no. I'm like, there.
Okay, education of professionals. We have a number of nurse practitioners, and they tend to change too, but honestly, our nurse practitioners, if we didn't have them, we'd be in big trouble. Simply because we have times where there's no doctors at all, no locums, no doctors, nothing. So our nurse practitioners sort of carry the load, and they are great. And one of our nurse practitioners complained about 15 minutes because she didn't have time to work with our seniors. They gave her 15 minutes, and then I don't know what happened, she quit. So we're back to stage one, and they're a plus to our hospital. And we need more to be trained, and it used to be that they trained in Yellowknife, but I'm not sure if that happens now, and of course we've got a new college coming in, maybe that will happen there. But we definitely need more. And I look at our small communities, I've worked in McPherson and Aklavik. I mean, one nurse in a community, or sometimes two. I mean, if they had a nurse practitioner, that would be a plus, like a plus. I don't know how smaller communities make it without nurses and without nurse practitioners. The other item that we have was the support programs for personal support workers. I talked to one of our gals that just retired who was the head of home care, and she's worked in a number of small communities, and she basically is saying, we need to train our support workers and our home care workers to be medically trained to deal with medical situations, because if you take somebody off the street because they have a senior in their house and they know how to do it, no, they don't have the medical background to be able to work and walk into a senior's home. If the senior looks like he's going to pass out at any moment, they don't know what to do. So we need service people in the community that are medically trained and that can deal with medical problems. And she's adamant about that. So, and I'm not sure, it'll be interesting to see where you are coming from on personal support workers training. And like she's saying, like some of the workers in the small communities, they have a grade 8 education. Like, how do they deal with medical problems? Like, it's not good. I mean, some people maybe just have the skill or the personality to do it, but do they know how to deal with a major problem? Anyhow, that's my deal on there.
Okay, and the last collection of issues, extended health benefits. Both organizations are concerned about a comment that the administrator of NTHSSA has made, that the system is looking at income testing for health services for all patients, and that might include seniors. And there is concern around that because a lot of seniors, of course, are on low income or limited income. So those kind of comments generate some angst with seniors without backup information. So recently, there was something on Facebook about renewing your extended health benefits and a reminder to renew your extended health benefits. There was no age given. That was kind of the direction. You could go to the website. I have to point out here that not all seniors have computers or computer skills. So this is not a good way for a senior just to say, go to the website for more information. Since I started looking into this, it has been clarified by somebody on Facebook that what the age eligibility is, so seniors don't need to worry. But the initial advertising causes some angst without some criteria around it. The GNWT Health has long said there'd be no changes to seniors' benefits, and we're kind of getting some rumbling in the background that this may not be the case. So that's causing some angst with seniors. So we need clarity around that. In addition to extended health benefits, I noticed yesterday that there's a new system now in Yellowknife to get appointments at the lab. And again, you have to have a computer to go to the website, fill out the form, and submit it to be able to get not a same-day appointment. You still have to line up at 7:30, but they will get back to you within 5 business days. And so a concern that I see from that is that these ways of doing things are only causing more confusion. And I really wonder, when they are developing these new systems, if they do any pilot testing or look at who they're trying to reach. Because again, I will say that not all seniors have computers or the ability to even be on Facebook to find an ad or be able to do a search on their computers. So we need clarification around the health benefits. In closing, you've probably heard enough of our rambling. Well, in closing, both our organization feel that the health system is too top-heavy, and you've probably heard that before, while service delivery is being compromised. And I personally have worked in health for close to 50 years here, and I've seen changes and things done and undone. And right now, looking at the system, you look at all the administration, all the money that's going to that, and yet we have all these problems at the community level for service delivery. We feel there is sufficient funding allocated to the health system, but it is not being used effectively or efficiently. And thank you for the opportunity today.
Thank you so much to the NWT Senior Society and NYQ Senior Society for that presentation and for sharing your insights and a bit of your personal stories too. That was super helpful. I'm now going to ask members if they have questions. This will be an opportunity to do a bit of Q&A. Okay, we'll start with MLA Testart.
Thank you, Madam Chair, and thank you very much for the presentation. You'll be perhaps pleased to know that many of the issues you're telling us today is either things we've heard before, things we've talked about in the House, or things that we've experienced ourselves. So I no longer have a family doctor, and that's been a big impact to our family because we, of course, have young kids, we have needs as adults as well, and not having that continuity of care is really impactful on our household. And my parents live in Yellowknife; they're seniors, and they've had, need access to medical care as well. So my family really understands the issues you've spoken of. And they're very acute, and they're becoming more acute as we move forward. And the question of seniors' benefits, I was just trying to find the Hansard clipping, but I put this to the minister on the floor of the House, and I said, will you commit to no changes to those benefits? And she did agree that as long as she is minister, you're not going to see these changes. They have repeatedly said we're not changing seniors' benefits, but they have left a little wiggle room there that maybe they'll change that. But we do have a personal commitment from the minister on record, so that should give you some comfort. And certainly, these changes to extended health benefits are not something that I support, and I certainly won't support any clawbacks or reduction of benefits to seniors. Some of the things you mentioned about medical terminology, I do have some questions, but some of the things about medical terminology, is that like a complexity issue that it's just they're responding to patient concerns with jargon or technical terminology, or is it a language barrier issue where you have elders in small communities who aren't as proficient with English and therefore don't understand, or or is it related to dementia and Alzheimer's care and things like that? Could you elaborate a bit more on what those challenges are so we can find ways to, or bring forward solutions? Thank you, Madam Chair.
Okay. Ms. Christensen?
Sorry. I am aware, from working with communities across the north, this has been a long-standing issue, of providing information, and I'll say now, the senior group, in a language and complexity that can be understood. So we always worked with plain language was essential, and you'll find when you become a senior, when you have less time, you don't want to have to read 3 paragraphs, but imagine if English isn't your first language and you're receiving information in English, but English isn't your first language. And so it can become dangerous. And also you have to look at cultures where questioning a health provider may not be appropriate. So a senior can be listening but not really taking the information in because they don't understand the terminology. And if it's there are language issues for sure. So we have 11 official languages. We seem to be able to fill the French need, but the other languages maybe not so much.
Okay. Do you have a follow-up question, Emily Tester?
Yes, thank you, Madam Chair. There are you mentioned culture. I'm not trying to do the government's work for them because the minister and the healthcare system should be responding to these concerns directly. But we do know that there are cultural safety programs in place that locums are required to take. Now, how effective those are and how they're working, I think we could have a conversation about that and see how patients are feeling about whether or not those are sufficient supports. I'm really interested in your furthering the discussion around medical travel, because I personally believe the medical travel system is one of our largest cost drivers and is hugely inefficient. If we're going to reduce those costs, and we've heard this from physicians, we've heard this from nurses, we've heard this from patients as well, that models of virtual care are a solution to that, where you could do a virtual appointment with a doctor on things that don't require a physical examination, like a follow-up. Because right now we're flying people to Edmonton for follow-ups that don't require any kind of physical examinations. It's just getting them to the doctor. And if we could do that over a Zoom call, that would save a lot of resources that then we could put into the system for recruitment, retention, and even supporting benefits that are now being income tested for many people. But we've also heard you talk about the computer literacy issues, and that not all seniors either, and in small communities you might not have the same access to the internet and access to computer technologies that would facilitate those virtual appointments. So do you see that as a problem, I guess? Like if we switched to or not switched, but if we brought in more virtual care models, would we be leaving seniors, and particularly seniors and elders in small communities, out as a result of that? How do you envision that? Would there be like, if you don't want to do the virtual, then you do the old medical travel model? Just trying to find a way that works for seniors and elders in the Northwest Territories. Thank you.
Yeah, either Ms. Christensen or Ms. Bernstein, do you have any thoughts on virtual care with seniors?
That's interesting. I do all the emails out for the Hay River seniors, and we have a number that are not on even emails or computers. They don't have them. They don't use Facebook. Like, I'm not sure how you would deal with that. Like, we phone them. If we can't get a hold of them on email, we use the phone, which means you could use, I suppose, phone, but then you're still not going to get the information you need. But it's because, I don't know about, it has to be worse in small communities where the internet link is not that great, because they would have difficulty basically even getting the email or the virtual appointment. So the smaller communities, I think, would be in worse trouble than we are. Like, I mean, we can always say, okay, you can come and use my computer if you have to do it. But yeah, that's a problem. And I mean, we're getting less people that don't have, don't have computers. It's getting better, but it's definitely a problem.
Can I add?
Yeah.
I think it's a system that should be explored and could be offered through the health centers. I think there's a way of strengthening that communication. And I realize that there are some professions or providers who do not like that system. And an example I have, because we looked at this years ago to see if we could do counseling over that type of system. And the only comment that was made was you need to have a face-to-face first to know the person. And then doing things online like that or virtual will work out. What it would mean for many seniors in small communities is that they don't have to go through the hassle of medical travel, getting here, getting to Edmonton, and the angst around that, because there is, you know, am I going to be met, even if things are in place. So I think when you look financially, that is something that should be looked into rather than continuing to put money in medical travel.
Okay, thanks very much. Next on the list, I have Emily McNeely. Do you have some questions?
Thank you, Madam Chair, and thank you for your presentation. And as my previous colleague had mentioned, it's issues that we are going through, experiencing, and continue to hear. I represent 5 communities in the Sahtu, and we're remote and isolated, so a lot of issues. And medical travel is a huge one. Over the weekend, I was dealing with 3 situations on a medevac, and medical travel is always a problem, and we keep trying to say, okay, how can we make it more efficient? You've got NHIB, which gives the approval as part of the medical travel system. So when you review the system, making it efficient means bringing the approval process home. So we have people that could go to the office there if they got an NIHB issue. And if we want to talk in person, like I feel caught in the middle at most times when I hear a constituent talking about medical travel and an escort. Well, I gotta go through the red tape process of getting the consent form, and some elders, you know, they can't read or write, so those are issues that we have a system that could be a whole lot better. So I guess in short, I hear you on the staffing and morale issue. I'm glad you raised that. My opinion is how to fix that is our system is plagued by a lack of workers. So we have to invest into education. And I try to be there for the graduation on May the 30th. We had a local individual from Fort Good Hope, born and raised in Fort Good Hope, who graduated to become a nurse. Why are we not exposing that success story rather than shutting down your community learning centers, which really defeats the purpose of investing in education? So to try to answer that, I've developed for this is your information, is developed a proposal called NORTRAN, and NORTRAN is a name given to trades training readiness for reclamation and remediation, particularly designed to focus on trades. We've got an empty classroom in Norman Wells. I plan to fill that up. There's an empty office there and empty houses, which could be student residential units. Okay, where is the O&M gonna come from to pay for the delivery of this list of academic courses designed to improve your next generation workforce coming up? To date, as of 24, the federal government, as the owner of the Norm Wells oil field, they get 2 checks. They're partners with ESSO, so they get a profit check and they get a royalty check for the subsurface minerals. They have taken out $2.7 billion. I'm quite certain that we can reinvest that into the O&M of Nortran, and there you got an institution that is delivering trades to a society that desperately needs that. Whether it's practitioners or whether it's nurses, let's design an academic institution to deliver that. And let's encourage our high school students. There's a combination of a number of efforts that could be done to invest in education, and from education, we continue to offer the successes by trades. I think that's the only way we're gonna have 10 nurses per year for the next 10 years. If somebody's got a better idea, I'm all ears. But I definitely hear you. I definitely hear your organization, and I always try to move forward to what is the solutions? How do we bring the morale up that you had mentioned? Do we need to send our administrator there to have a cultural type workshop and try to encourage people to stay there? And we have one doctor in our region serving 3,000 people. And that person has to fly in and out. So our society is really hurting in many ways. So I think well, personally, I hear you, and I know we have to pull up our socks in a number of areas. And education is dear to me, because I really feel that our younger generation really need the education and mentorship to open their eyes on what could be a real secure lifestyle with that certificate in their hand. Thank you.
So no questions per se. Okay, if you want to respond to that, I guess we'll start with Ms. Bernstad and then Ms. Christensen if you want to add.
I really like what I'm hearing, and we need kids in the classroom, and like, when I hear this, that they should all go online, I know what happens to students. I taught students for 30 years. If you're not there and mom's not there and somebody says, you need to get that work done, they don't do it and let it go. Well, I'll leave it till next week. I mean, we've all done that. But I think back to, if there's an actual place and you've got an instructor that's saying, hey, I need that next week, not the end of the year, but next week, it gets done. And what we're doing with our kids these days, I find that they don't seem to get too much ambition to do anything. And I'm just making a generalized statement there. I mean, there's lots of kids that aren't like that. The other thing, when I went into education, I grew up on a farm. We didn't have a lot of money. I didn't have money to go to college. And the community where I lived put out bursaries for any student that wanted to go to college. They would pay their way for the first 2 years. And of course, those are the days where you could become an educator in 2 years. And so that's what I did. My dad, I mean, he sold one horse so I could go to college, and I got a bursary from the county. And so I went into education, and that's the only reason I did. I actually wanted to go into social work, but I couldn't afford it. So maybe there's a way of getting kids into it. The other thing is work experience. In Hay River, when I was teaching there, we had kids working in the communities, going out work experience, and checking out if they liked the idea of a hospital work, or working with the RCMP, or working with business. Like, get the kids out there finding out what's there. And then they say, hey, I sort of like doing this. And so that's another way of getting kids out working. We need kids working in the field, and we need people coming up to work. And I look at all our homeless, I'm going, why aren't you working? Anyhow.
Another issue. I'm just wondering, when you talk about having community-based training. And you can correct me, Mr. McNeely, if I get this wrong, but in Fort Good Hope, and I'm looking at housing that's going forward, and how they've created training programs, community-based training programs, so that you're not having to bring in so many workers. Your training and those skills are being left in the community. And I think that they need to look at that more for health. Now, my experience had been with community health representatives. This was quite a while ago, when the students were required to come to Yellowknife. And that meant disrupting their families or bringing families with them if they could. And it was predominantly women who did not want to leave their children, wanted to have them with them. And they looked at the program and they started to divide it up a little bit so that it was modules, and people didn't need to be away from home for so long, or some of that could have been delivered at the community level. And I think for health and in trying to get more youth or people into the health field, that might be something to look at. There needs to be more community-based directed learning and inspiring youth in the communities to take those programs. But it's not always easy to come to Yellowknife and make that commitment. So we're losing out on valuable potential youth in the community getting into the health field.
Okay, thanks for that. Do you have a quick follow-up, Mr. McNeely?
Yes.
Okay.
Thank you. I got a couple of points. I'm trying to encourage and work with the youth in Fort Good Hope and using the Fort Good Hope Construction Center to visualize the importance of trades training. To produce these modular units out of this building, I was just there a few weeks ago when it's all closed in and they're working on the inside. But at the end of the day, they're going to produce a product that is going to have to be met by the National Building Code. So in order to do that, you need trades, certified plumbers, electricians, and so on. So I'm really glad to help visualize a solution to increase trades by using that project. But my question to you is that, have you made reservations? I like your presentation. And have you made reservations there to do the same presentation to the administrator for NTHSA? Dan, I think his name is. Thank you.
Thank you, Mr. McNeely. Do you know who Mr. McNeely's talking about? Okay, yeah, go ahead. Ms.
I don't believe, and I'll ask our executive directors, we have not received such an invitation as we have today. One of our recourses is to go to the Regional Wellness Council meetings, where information is presented by the department, and there's an opportunity also to present on some issues. I don't know how effective the Regional Wellness Councils are as a communication. Across the north, I'm just familiar with the one for Yellowknife Health and Social Service, but that is one way to be able to get issues kind of presented.
All right, thank you for that. Next on my list, I have Mr. Hawkins online.
Thank you, Madam Chair. Just looking for a thumbs up if you can hear me clearly. Okay, perfect. Thank you. Just didn't want to prattle on too long and realize no one's listening. So first of all, thank you very much for your presentation. It's sad but exciting. I always love hearing seniors. I like to think of myself as a believer and as a strong advocate for senior matters because it's such an important community in our community. One of the issues you had pointed out in the presentation, I just wanted to highlight in particular. I'd been doing some community discussions as of late, and actually, oddly enough, a senior had pointed out one of the things about waiting for the same-day appointments where they had to show up at 7:30. They were asking for chairs in the waiting zone, not even in the waiting room. And that way they didn't have to stand for 30 minutes. I'm going to take it one step further. They too, oddly enough, interesting, had mentioned the DMV system, but at least taking a tag and so they could sit. But that said, they pointed out how they had to go down there and they didn't meet the queue number. In other words, they were just too far deep into it to get a same-day appointment. So that causes frustration. So just to augment your earlier point, excuse me, of someone having to come down via cab, take a taxi, take the time, do the whole system of getting ready to get down there, including the morning brain fog that I seem to suffer from. I can appreciate the fact that it is a struggle to get down there and then to be turned away. It's got to be emotionally frustrating by all means. And of course, that's when you feel the system is not only not working for you, but failing you and everyone as a whole. Furthermore, could we phone people, the old-fashioned dial in? Well, recently I was contacted by someone, will say in later years, I wouldn't quite say elderly, but they called, finally had someone answer. So that's a unique experience by itself. They answered and they refused to take the appointment, even though it was the right office, and told them to go back. And basically the only option to get an appointment was to book online, even though they're speaking to a real person. And again, that's a unique experience given today's circumstances. And I certainly hope that some of this, Madam Chair, is for the committee. Some of it's for our guests, both online and in the gallery, but I'm hoping someone from health is paying attention to this particular issue. So here we are. We have all the fantastic tools of the world. And in Denmark, you can call for same-day appointments if it's of urgent nature. And it's not for me to triage, but they can triage. We have a very competent system. And I just want to point out that there's nothing here that we couldn't do that they do elsewhere, such as serving our seniors, certainly in more an urgent message. If I'm hearing them correctly, one of the presenters had pointed out the time of an appointment is an issue to ensure that they're fulsomely treated. The relationship is not there, and the consistency is not there. And all of that saddens me to hear that, because these are messages carried on by my colleagues, but they seem to be not even heard. So I'm disappointed to hear that. And excuse me. Sorry, excuse me about that. So my question for you is, if you could see maybe a minimum change that would start to change the paradigm of senior services or feeling they're part of the system that's being recognized, is there any particular, say, minimum standard we can certainly raise, either return to the old days or you see improvement opportunities that would make the difference in the community? And I'm trying to dial down to is what in particular do you think you're hearing would make the world a difference for you folks? Thank you.
Okay, Ms. Bernstein.
Actually, I think it's improved since the old days. I have my own particular, it took me 1 year to make an appointment, and that was when I was 75. And that was because my friend said, you should get a medical every once in a while, but I never got sick, so why did I need a medical? So I thought, oh, well, they probably know. So I tried to make an appointment. I was told I couldn't do it then because they had to wait till the locums came in. So that was a week, and then it was another week, and then I would go in. My sister has lots of issues, so she was to hospital all the time. And so I went, oh, I'll just go in and make an appointment at the desk. Well, they go, no, you can't do that. And so I went, okay, so I'd wait and phone again. Phoning doesn't work, Mr. Hawkins. Anyhow, and so I never got the appointment. And so a year later, I finally went in and thought, this is crazy. I can't get an appointment. I live in the community. Why? And so I said to the girl at the desk, look, can I get an appointment? And she said, she checks her books, goes, no. I said, look, I have taken a whole year to get an appointment. I have talked to our member of the ledge, and nothing's happening. I'm going to talk to the Minister of Health. And she went, oh, I can get you in on Tuesday. I should not have had to have threatened to get an appointment. So it has, now I can get an appointment and I don't have to wait as long, but maybe it's because I yell and holler. But what about the poor people that don't complain? Like, I mean, you shouldn't have to complain to get something done. And I don't know what the solution is to that, but I don't have to wait as long now. And so any of our seniors that complain, I say, look, I'll come with you. And they get an appointment, but that's not fair. So things have improved, sort of, but not overly. Anyhow.
Ms. Christensen, did you have something to add there?
Just a comment to that. Having lived in the system for 51 years, I don't think it's better. I don't think throwing more money at it has made it any better. No. I think that our population hasn't increased, and yet the problems with accessing health professionals have become worse. One thing, Mr. Hawkins, that might help us as seniors is to have a senior navigator that would specifically work with seniors. For example, a senior who doesn't have a computer and can't go online to get information, that would have the clear-cut information that we require. And an example of that is the turmoil that's been caused by the possibility of changing extended health benefits. There's no such position that is reachable. And I think that, and it may be more than one position in the north, but I think that would really help seniors being able to sort things out and access the system.
Okay. Thank you very much for that. Mr. Hawkins, do you have a quick follow-up?
Yeah, thank you, Madam Chair. Just very, very briefly, to the first speaker, absolutely, I hear your frustration, and I agree. You know, we're taught not to yell to get attention, but unfortunately, sometimes no squeak, no oil. So I can appreciate the fact that that is a frustrating situation, and yeah, so I'm very sorry about that experience. I genuinely am. That is not the right way to do things, and you know that, I know that, but unfortunately, it fixed your problem, but does it fix the problem? As far as the senior navigator, actually, I'm happy. That's a great idea. I'd be happy to take a look at that and maybe talk to my colleagues further on that particular one as a point of contact. It wouldn't solve every day's problem, but that said, it may start over a bit of time, whereas then the seniors are finding they're frustrated and having a disconnect with the system, and the senior navigator through the Department of Health, whether it's directly connected or indirectly connected, can help sort of get the inside track and get things moving. So maybe it is a good suggestion, given the fact that the system itself likes these little extra appendage positions. That may be one of them that may make the absolute difference. If it makes a difference in a couple lives, then it probably could be worth it right then and there. And by goodness, last point, Madam Chair, is waiting and screaming to get an appointment is just, you know, we have to find a better way. And back to my earlier point, which is people going down even at the 7:30, standing there and still not getting an appointment. That is very difficult and abusive on seniors' bodies and on anyone that is. And I'm talking about emotionally tough. So we have to do better, and I certainly hope the department is listening. Thank you.
Okay.
Just a comment.
Yeah. Ms. Christensen?
I love your support for a senior navigator. I think our request would be, if they're looking at developing such a position, that it not just be government who's making the decisions about the position and what it's going to cover, that the NWT Senior Society and the Yellowknife Senior Society have some involvement in that, since we have the experience of some of the issues.
Okay, yeah, that's a great point. Thank you. So next on the list, we have Mr. Narasu online.
Yes, good morning. Thank you for your presentation. Very interesting. And, you know, these are continuous things that concerns that I hear within my region, not only in my region, throughout the NWT. You know, there's physical limitations, some elders that do deal with And also with the system morale, I had a patient or an elder from Klavik. She called me and she said, they called me this morning and I have an appointment in Yellowknife this afternoon and they want me there this afternoon. And she was on crutches. Yeah, I just lost audio and video for a bit. Her request was denied because there wasn't enough ample time to fix her up with an escort, so she had to go on her own while she was on crutches. So the system morale is something that has to be addressed, addressed and taken care of. And also, we have in our community of Fort McPherson. Also, I hear this from a Catholic that caretakers, uh, home care support is something that is much needed in smaller communities because our elders are having no choice but to elsewhere turn in their 80 periods. They get moved to Newville. And I even have a resident from Fort McPherson in Norman Wells because that's the only place that was available. And now she wants to go to either Inuvik or Yellowknife because the language barrier. She's Gwich'in and she's living in the Satu region because it's the only place that was available. She has a disability. She's legally blind, so she can't live alone. So her mental health is at stake at the present time because they're not meeting her needs. She needs to be around her people, where she can continue to live a good, healthy life with her limitations. And this home care support is something that I've always brought up with the minister in session that it's a preventative measure. If you're going to have our elderly people living within their homes, around their surroundings, then they have to have the home care support available. This will Yeah, I'm sorry about that. I keep cutting off. It keeps cutting off. If we have these home care support workers living in these home care in these facilities within our smaller communities, it'll prevent other health issues. And they want to stay within their communities, but this, the department is saying that they have facilities in the regional centers, but you speak to the elders within the smaller communities, they don't want to move to the regional centers. They want to be with their families, so they get the support. We have a lot of language barriers. The GNWT has to come up with programs where these language becomes one of the priorities, because I know there's an individual from my home community that's trying to advance a virtual language program, and I believe it's going to be very successful, but the government has to step in and do their part too. And escorts is one of the big problems that I've been hearing. A lot of times the elders, even though they have to fight with the system just to get an escort. I believe if the regional or local governments get involved, they can have escorts readily available to travel with them if a family member cannot, because it is a problem. So I believe the local or regional Indigenous governments can and should be involved in this with medical travel. The timely appointments, like I stated, these appointments have to be made maybe a week in advance so everything can be arranged with travel, escorts, and everything that needs to be done with that they need. And the education system has to improve. I've always stated that the education is not working. It's failing our residents of the NWT, especially in the smaller communities. If we want professional healthcare workers, then the government has to step up and improve the education system and do away with the social promotion. It's just it's not working. I've stressed this many times, and it's just once they get out of the education system, they're knocking at the income support door, and that's where they're staying. My region has a 15% rate of recipients who are on income support, and they're able to work, but they just don't want to. I have a minister's tour. Minister Semler will be attending community meeting on the 12th of September, and I've asked her to bring a representative of NIHB so that they can clarify some of these obstacles that the communities are having, who's responsible for what, and so we can get more clarification for the residents. The home care was something I really fought for and continue to fight for, because right now we have an elders home, and these elders are just sitting in their homes. No programs are provided for them. So they're not getting any, physical activities. They're not going out, being able to go outside because nobody's looking after them. If they had a healthcare support worker living within the facility, they have a big area where they can all gather, but that place is never used. I know we catered a supper there at one time just to get the elders together in that facility. And what they stated was this is the first time they've been in that gathering room. So, it's a preventative measure if they have programs available. I feel for, been listening to your program, to some comments, and I hope we can get the department on our side so that we can look after our elders. It's more of a statement. I don't have any questions. I just took notes, and I'd like to thank you again for your presentation. Thank you.
Okay, thank you, Mr. Nerisu. Do Ms. Christensen or Ms. Brinsat have anything? I mean, that was a lot of information. Do you want to respond to any of it?
Yeah, I think
Okay.
Mr. Neriso did a good job of actually highlighting some points that we tried to make in our presentation. But again, when you're talking about being able to provide appropriate, culturally appropriate services in a community, speaks to the need to have more community-based training. So there are bodies available who possibly would be interested in receiving some training if it was at the community level, to work in those, and it may not be a PSW position, it may be another terminology that's used, appropriate for the community, but looking at how to work with a community and look at the resources and what training or education can happen at the community level.
Okay. Mr. Nerisu, do you have any follow-up or any other questions?
No, I don't have any at this time. Thank you.
Okay, Masicho. Next, I think Ms. Wendy Bisrow, who is online with the Yellowknife Senior Society, I think wanted to add something about a point that we were discussing earlier. Ms. Bisrow, go ahead.
Thank you very much, Madam Chair. I wanted to just revisit the idea of a senior navigator position. Excuse me. A little bit of history. It was over a year ago that the Yellowknife Senior Society met with about 4 ministers at the Legislative Assembly, and we presented some of our concerns as a society. And one of them was the idea of a senior navigator position, which could provide all kinds of assistance to seniors, both within Yellowknife and without. So we did not hear anything back from any minister. They nodded their heads, of course, when we were there. But I wanted to just say that we have presented this to several ministers, and I'm speaking on behalf of the organization now, but we would be happy to present the committee with our presentation to the ministers in regards to a senior navigator position. The info is still there, and it could be reworked and presented to you guys quite easily. Thank you.
Okay, thank you for that offer, and I think committee will be following up with the society. Next, we have Ms. Cheryl Yakalaya online, MLA for the Decho. Ms. Yakalaya, go ahead.
Good morning, and thank you for your presentation. I know Jill. I worked with Jill in many years ago, and we worked together on the CPNP program. And so when we had that program, there was lots of education and lots of teachings going on with that. So we had, education things that we had to learn from, and then we came to Yellowknife and did a lot of stuff. So there was a lot of teachings and a lot of mentorship. So now I want to ask the question is, does the NWT Senior Society visit and do these types of visits to the communities? Do you guys go out and visit remote communities or the communities in the north and talk about, because when you do that, you can also bring the information to communities about mentorship programs, different things to help seniors in the community. So that way, that information is given to the people in the community, and people, how things work in communities. Everybody talks about it, and then they bring it up, and then we get heard from, and so it will help the communities to talk about all of these issues in the communities. So that was my first question. Do you guys travel to the communities? Thank you.
Ms. Bernstein?
I don't. I mean, I pretty well come here in Hay River.
Sure, why don't you, Ms. Willy, why don't you come up to the mic there with the NWT Senior Society?
The NWT Senior Society has members in the regions across the NWT. So those members would then have meetings with their constituents to talk about this. So for example, in Fort Simpson, Martina Norwegian meets with people across the Decho, because she's the Decho rep, to bring issues forward. We do travel for specific issues, so we'll be going to 3 communities this year to do work on, to provide information through town halls on Alzheimer's and dementia. We do elder abuse, train the trainer workshops, and we do elder abuse workshops across the north. So we don't have the funding to be able to just go randomly, but because we do have members in most regions, we do get information from seniors. We also have the senior information line, and we get a lot of calls from seniors across the north about health issues, about housing issues, about various issues.
Great. Thank you for helping us understand better how the NWT Seniors works. Ms. Yakalai, do you have a follow-up?
Yes, I do. I know when I was doing this type of work, I I went to, the NWT, the Women's Society anyways in Yellowknife, not the Native Women's, and we partnered up and we partnered up and paid for people to travel to communities. Is that something that the senior society can do with the communities? Thank you.
Sure. Ms. Willy.
So I believe you're talking about the Status of Women Council of the NWT. And in the past, they had positions to be able to do that. They no longer have that kind of funding either. Funding is a very big issue for getting out into communities and reaching people. But we do partner with NGOs through the NGO Coalition, and that's territorial. And so our information does get out in that way as well.
Okay, Ms. Yakulay, your questions have been shorter than some of the others. If you wanted to ask one more quick follow-up, I would allow it.
Okay, great, thank you. I also, in the presentation, I heard that, I think it was Ms. Christensen that mentioned that that there is enough money for healthcare, but it's not being used or allocated well. Can you elaborate on that for me? Thank you.
Sure. Was there anyone who would like to answer? Ms. Christensen?
Open to can of worms. Is it perception? Is it perception that there's more and more positions being funded in the actual department? And it is perceived as very top-down. When you look at allocation of funding, and I remember at the trade show in May, the Mother's Day trade show, the GNWT had their booth, and they had these almost like Lego blocks, so the public could come along and say, oh, you need to take more from here and put it here, and more into health, more into health. And I talked to the woman behind at the table, and I said, we don't need more money. It needs to be used differently. And so the perception, public perception, not just for seniors, is that you have all these more and more positions, more and more layers of administration that takes away the funding. And it's the bottom, the feet on the ground people who are not realizing an increase in their services. And an example I can think of, having worked with federal funding for a long time, and Ms. Yakulay mentioned the CPMP program, which is the Canada Prenatal Nutrition Program, which is how I first met her and mentored her. The funding came from the federal government, and then it was siphoned off by the department, and then each community got a very small amount to work with. And it seems like we now have a system where you can see it. The perception is a lot of people up here, and some of them you wonder what they do, when down here, the ground level with service providers is not improving. In many ways, it's getting worse. So I think that we could look at, yes, there's enough money. And I have to say, at the trade show, with these Lego blocks, I said to her, we don't need more. We need to use it more efficiently and effectively. My response?
Okay, thank you very much for that. I'll ask a few questions of my own now that committee members have had a chance. One question you brought up in your presentation that you would like to see an increase in home care supports. I wonder if you could explain a bit more about what you see are the gaps, or what more specifically you'd like to see improved about home care. Is it that you want it to reach more people, that the existing services should be offered more frequently to existing clients or, changed in some way, the criteria for what's offered? I just wondered if you could explain a bit more about what you'd like to see for home care. Thank you.
I spoke on that, and just keep in mind that I'm not a home care worker and I'm not a health worker either. But I'm talking to the gal that ran home care. She said there was a problem. They didn't have enough gals to go out and work in the field that had the knowledge to do it. So it wasn't a case of not having enough bodies. It was a case of uneducated bodies.
Okay, so focus on better training for workers and expanding maybe what they're able to do, what they're.
She said like they would hire people in the community, somebody, I don't know if she was in the hiring, but that they didn't have the skills. They could walk into a house and they have a senior there that looks like they're going to pass out of the picture and they have no idea what to do. They don't know how to check their blood pressure, like no medical skills. Like that was her biggest, they hire them, there's no medical skills. And she said, if you think there's a problem in Hay River, it's going to be worse in the small communities because they don't have a lot of people educated in the health field. And so you're hiring whoever needs a job. And so you've got not a good system working. And that's all I know because I'm not a healthcare worker.
Ms. Christensen, did you want to add?
And I can give you some other examples. I've kind of alluded to it. There is an issue around respite care and the consistency in that and the increasing need for respite care. If we're going to have seniors aging in place, which is ultimately the goal, it's a really heavy load for family to be providing those services. And to be able to know that there is some kind of respite care available consistently so they don't feel like they're just trying to grab 2 hours a week. Ultimately, if you look at being able to have seniors age in place, you are saving money in the system because you're not going into a home. Mr. McNeely mentioned an elder wanting to go, if they came to Yellowknife, and there's a language barrier. And I've seen that years ago at Avens, and it's sad to see. But I think for home care, there is that line where the nurses, who do an excellent job from my experience, are trained nurses. And the PSWs are trained to be a PSW, but then if you have another kind of home support worker, and I think what Pat's saying is sometimes the service is not appropriate if you have a senior who the needs are getting more medical, that they don't have training in that. But there's certainly a need for more respite care, and we see that here in Yellowknife and all the communities.
Do you have respite care here?
Well, I can't speak from experience that I do, but I know people who have used it, but it wasn't consistent. So for example, if you have you're keeping a loved one with Alzheimer's at home as long as you can, that's a heavy, heavy load to take on. And you do need to be able to step away from it, but the respite care was not consistent, and it's not enough. An hour is not enough to get errands run or that sort of thing. So there's a lot of fatigue with families who are trying to support loved ones at home.
An hour isn't long enough.
Yeah.
Yeah, thank you very much for that. And that is certainly an issue that I've raised in the House and raised with the minister, especially for seniors experiencing dementia and Alzheimer's and caregivers needing more of a break. And we've raised the idea of a day program. I think the minister at the time sort of referred back to, well, we have home care program, we have the respite program, but like you're saying, I think the issue is that, an hour a week or something is not enough to give meaningful for respite. So that's certainly something that I'll continue to talk to the minister about, and others, hopefully some of my colleagues will as well. Quick follow-up, you also mentioned in your presentation that around staffing, you're asking questions about how the GNBT qualifies or certifies various healthcare professionals, doctors, nurses, and it looks like you're asking about how we can streamline the system, but do you have concerns about certain healthcare professionals not being qualified enough, or the GNBT not sort of checking or certifying that people have the proper qualifications? Or I just wondered if you could explain a bit more about your concerns or questions about how the GNBT is qualifying or certifying, say, doctors and nurses. Ms. Christensen.
It's not so much a question of the qualifications. It's knowing that there potentially could be bodies there that would be interested, but how long does it take and what system does the government use? I know that you can't always take a health professional from another country and say, oh, they've been trained adequately to meet our qualifications, but there must be a way to look at how that training can be provided so that we can take advantage of health professionals who are living in the north already but can't practice.
Thank you for clarifying that.
The other thing,
Ms. Bernstein.
we have 174 doctors coming into BC. I mean, there must be few people coming in from America with all the problems we have right now. I would be interested to see how do we obtain some of those doctors, and then are they certified? And does NWT do any certification? Like we had several, you were at the meeting in Hay River, I think, when were you there? 2 nurses asked about being certified in Hay River so they could work there, and they had been trained, and they looked, I don't know, they looked Mexican, and I'm going, yes, we could use more nurses. So how do we certify them? And I don't know what happened there, because of course then the minister wanted to talk to them.
Yeah, and my understanding is that we don't currently have a mechanism, certainly for doctors, to, like, on our own as a jurisdiction, certify doctors. We have to send them to another jurisdiction first. So, I mean, I know we have also raised that, both for doctors and nurses. I think there's a relatively new system coming in around ways to get more nurses certified or able to work in the NWT. It is something that is being worked on, but certainly it's helpful to keep flagging that and stating the urgency of the need to make sure that we have access to as many qualified healthcare professionals as possible.
But if we get more in our own communities, would be even better, wouldn't it?
Yeah. Okay, thank you so much for that. And I don't actually see any more. Okay, we can have a few second round questions if others have questions. So MLA Testart.
Thank you, Madam Chair. This is more particular to seniors issues because we happen to have the 2 seniors organizations here. But at least since I got involved in territorial politics in the 18th Assembly, the aging demographics were well aware to every government in Canada, and it's still something that governments are seemingly struggling with, even though they've had foreknowledge of things going. We've seen these kind of implosion of the healthcare system, at least to the standard that Northerners have come to expect under this government. And we've also seen a change in cabinet responsibility where there's no longer a minister responsible for seniors. And the premier making that decision said, well, that portfolio didn't have any resources attached to it. So, and it was a siloed approach. So now there's, as many as 4 ministers that are all responsible for seniors, and you can go talk to them. So from an organizational perspective and kind of a seniors community perspective, how do you feel the attention of this government is towards these issues, and how easy is it to get the attention of the highest decision makers in the government? Because before you had 1 person to go talk to, now you've got as many as 4. Is that making it easier or less easy? And do you find that this government is prepared for the challenges that seniors and elders in the Northwest Territories face in their everyday lives? Thank you.
Thank you, Mr. Testart. Do we have a volunteer to answer that one? Ms. Christensen.
Was dismayed to see that the position was done away with. instead of exploring how it could have worked. And having 4 ministers responsible, I don't think is an efficient, effective solution. So we would like to see the reinstatement of that position. What it almost says is, we've done away with the position because you're not important. And that's what it feels like. The demographics show there are more seniors, people who want to stay in the north, who aren't moving out, because that used to be a trend, who are living here and living out their lives here. And I think that needs to be considered all across the north, to be able to support this age group who've given a lot to the north and to the communities. So the payback is, now we're going to remove the minister responsible for seniors and have it spread out. And that says to me, you're not important.
And how do 4 people focus on seniors? You know one guy's not gonna do his job. Like, I don't know. It just sounds sort of impossible. And besides this, as a senior, I didn't even know that happened.
Emily Tester?
Thank you, Madam Chair, and thank you. I know sometimes political questions like that are difficult, but I did want to get your perspective as an organization and as a community. My parents moved away and came back. So I agree with you. I think more and more people are retiring here. We're also hearing that in professional contexts as well. I work with firefighters, and they're telling me before you'd leave and retire elsewhere, now you're coming back, which is, adding to healthcare as well. Like, the more people we retain, and I hope we retain as many Northerners as possible, but that means we need a robust healthcare system that can care for people. So I really appreciate your perspective on the issues. I appreciate you taking the time to speak to us today. And I think this is really illustrative of the challenges we face. And thankfully, you're not alone. This isn't just an acute problem for seniors. It's something that I'm experiencing, my family's experiencing, people I know, and young people are experiencing too, which is going to help solve these problems if we can all continue to keep the pressure on decision makers to make better decisions. So you have me as an ally in the fight, and I think it's a multi-generational effort to improve the system for everyone, so we can build a sustainable healthcare system that takes care of Northerners. So thank you for being here. Thank you, Madam Chair.
Thank you for that. Okay, not seeing any more questions from committee. I think we'll move to close the public hearing. Certainly, I also want to extend my heartfelt thanks to the NWT Senior Society, the YK Senior Society for taking the time this morning. I think we've heard a lot of important insights. So this concludes today's public briefing on healthcare accountability and sustainability. The public proceedings have now concluded.